chemicals have a life of their own. One doesn't really think of them that way, but they're first produced. They're released into the environment, say in products or in the air we breathe, and at some point they find an end location, if you will. Let's say it's the plastic bottle that you've been consuming to get your water for the day, or a bottle that you're using for workouts or what have you. That bottle, once you throw it out, finds its way into a final location where it's really not being used anymore. It has to be put somewhere. So in certain situations, those are landfills. In certain situations, they're recycled, and then they re-enter the chain of production. And there are hazardous waste sites mostly from 20 to 30 years ago, but still new hazardous waste sites crop up every day that result especially when, but not always when, hazardous wastes are not well managed. Sometimes they occur even when hazardous wastes are managed as best we can understand them, and some of them happen through catastrophic incidents like the one in the Gulf very recently. There's likely to be its own Superfund hazardous waste site in its own right. I don't think anyone would dispute the broad scale exposure that's occurred there. So it's in sites like that that there are special concerns about levels of exposure, especially because communities thrive around there. You can't simply move. If you moved everyone more than a mile away from a Superfund waste site as it's designated by the federal government, you would have a much different geography in terms of population in the United States than you would have today. To describe a little bit about the Superfund program, it was established about 25 years ago to provide specific federal funding to facilitate cleanup and proper assessment of certain sites. Sites that are identified as concerns are presented to the Environmental Protection Agency and then vetted for possible urgency of intervention, largely because there's a population that's clearly exposed, a pathway by which they're exposed, and a real health concern that one can link. And if you put all those together, usually you have a compelling case to become a Superfund hazardous waste site. Here in New York City, the Gowanus Canal, one of the river pathways near Brooklyn, has been recently identified as a Superfund hazardous waste site. The Hudson River is actually the longest Superfund hazardous waste site from an old PCB, or polychlorinated biphenyl exposure that occurred in the 1970s. These hazardous waste sites are largely remediated, but they still pose significant concerns to people who live around them. And one major concern is the impact on children's health, whether it's the school that's sited on the Superfund hazardous waste site or the homes that are sited near a potential hazardous waste site. And then there's the population of hazardous waste sites that are not Superfund waste sites presently. So these are all concerns that exist and explain the existence of a Superfund program. Well, the good news is that most of the chemicals that were deposited into the Gulf rapidly evaporate, at least the ones of concern. So if you don't live right exactly where the oil spilled, or you're not a worker cleaning up the contamination, to a large degree, and I'd like to explain why I'm using the phrase "to a large degree" as a modifier. To a large degree, immediate health concerns are not something to weigh as deeply. However, there's a lot that we don't know about the long-term health effects of certain chemical contaminants that were deposited, and we know precious less about some of the chemicals that were used to contain the spill. And it's important to continue to monitor the contamination potential in the fish that may continue to be an issue of concern, though even so far the levels are very minimal. That's why it's been a good step forward that there's actually a worker monitoring study that's been implemented from the beginning, from a very early phase, to follow the population of people who are rolling up their sleeves and helping as best they can to contain and prevent further progress in the spill. And it is through research like that that we have an opportunity to learn a tremendous amount about these chemicals. You never want an experiment like that to happen, but at least you should take the step and really document whether there are potential health concerns in the population, and you can actually do something about them for the workers themselves if you intercede on a proactive basis. And that's what we're doing here at Mount Sinai with the World Trade Center worker and screening and treatment program, where my colleagues who are adult medicine doctors are actually following the workers who participated in the cleanup of the 9/11 site.